not a shoe in.
Oh, mierda.
Just local, right?
Yeah.
Yeah, good.
Yeah.
Hang in there.
I can't. I don't wanna hold you in our heart. It makes me wanna work. Remember that show?
I want to hold you in my heart. Makes me want to fart.
You remember that show?
No.
Camp Onawana from.
Oh, Camp Onawana.
Yeah, I forget what it was called. Salute Your Shorts.
Salute Your Shorts. That's right.
There you
Oh,
go.
gosh.
It just came out. That's the song that came out of my brain in that pain. My son every day goes, "Hey, do you work on it?"
This is just local, right? Just local?
Yeah,
Good. Okay.
buddy. It's local like a mofo. Oh.
This turned it off right now. Like
It should.
It's like
It should. It takes this.
turned right off.
Yeah.
Last time I was here was in the darkest place I've ever been in. Just I guess what depression is,
Yeah.
and was starting to I'd cry like every day about my back. Like you saw me, and a friend of mine, wife's at work, was like, "You have to try our chiropractor in Venice. Stop driving so far. Just trust me, trust me, trust me." And I told her, "No, I'm just sticking with my guy." And one day she kind of just was like, "What are you afraid? You afraid?" Like she kind of tried to play me a little bit, and I was like, "Stop it." And I finally went, and it was a thing they were trying to push on me called manipulation under anesthesia. And I was not even, there was like, "You're not putting me under anesthesia. A, B, you're not trying to manipulate me under anesthesia. I've been told my lower back's basically frozen and it's not coming back." And they wanted to push that, and I said, there's no way, but I'll try whatever treatment you have with this laser. They kept telling me about a laser. I did the laser, and the laser worked, and then I kind of slowly drifted away, kept doing my stretches. The times they touched my neck, I never felt confidence in their hands. His hands, I always felt like, okay, that was easy, and neck's a scary thing to get over it for some people. For me, it was not easy. And anyways, my neck started up again. Just tasing me down my arm for the last 18 days, just being electrocuted. And I knew I had to come back here, and I'm glad I'm back here.
All right. So we're going to get an MRI hopefully soon, and we'll go from there and see what that's looking like. I'm expecting to see probably some disc injury, but might not be. Could be just a lot of bruising in there. But we're check that out. Cross the arthrometer monitor over. Take one deep breath in, and then they'll sit up. And exhale. Head back. Let it all go. Take a deep breath in. Here we go. Exhale. Let it go. Let the air out. There you go. Good, one more. Real tight there. Exhale. All right, yeah.
Does it help that I fell asleep on the couch last night till 5?
No, it didn't. Toughest guy I know has got pink pants. It's when you know it's when you know you're confident. That's right. I can kick anybody's butt, Ed. Deep breath in. Exhale. I know. All right, good. That's it for me. Sorry. Here you go. Here we go. A little bit there. Face up. There you have it. Very good. On your back. Well, the laser helps to harden things. When you have it sprained, you can use the laser on an area that's injured, and it, to me, it does. It's kind of like a hardener. It's like an ice cube, like we were talking about with your neck. You can use the laser to make an area more solid. Now, for the purposes of what mainly I do in here, I'm doing the opposite. I'm trying to loosen, right? I'm trying to take areas that are frozen and get them moving. The laser takes an area that's injured and can stabilize it, or make it not so sprained. And so they're great. Some of the qualms I have with laser is that even the word laser is too, we'll say, ambiguous. There's about 100 different types of lasers. There's 100 different types of frequencies. Every laser company says the other laser companies don't work. And so you have to know exactly which one they used.
I didn't just opt to want a laser shot into me. I did research, and
I
thought, all right, there's nothing radiating me. Okay, I will give it anything a try at this point.
Yeah, it's fine. Yeah, it's fine.
Apparently, what I studied was it increased the ATP in the scar tissue or something like that.
It's hard to say. they say it increases circulation, and then I say, okay, so you'll see warmth and redness, and they say, well, no, it's microcirculation, and I go, okay, that doesn't make any sense. If you but I'm okay with entertaining it. If it helps, it helps. I just, I keep talking to the guys that make the lasers, and I keep asking questions, and maybe one day I'll have a laser in here. I'm not there yet.
Electrocuting right here.
I know, I
Firing
see it,
that up.
I know. So we got the pinched nerve on the right lower, so we're gonna try to loosen up his upper neck. The nerves leaving his lower neck are going to his right arm, and he's feeling electricity out here. So this area, we've been doing some ice, and I know it helps a little bit, but just trying to take the stress off his lower neck, so we're gonna do as much as possible. We're gonna loosen up his upper neck and loosen up his upper back. His back was much tighter than it's supposed to be. So we're gonna try to move the stress away from his lower neck as best we can and try to calm down the lower neck as best we can. It's a tough one. It's a game of millimeters. Relax, I got you, bud. I got you. It's okay. Let it go. Here we go, bud. Let it go. There you go. Beautiful. Yeah. Very nice.
I had some really garlicky Italian last night.
Get out of
so
here. You're fine.
Forgive me.
And
Brushed them good, but
then relax this right side. 1 second. I got you, bud. Relax here. Okay, yeah, we got work to do over there. Yeah. The right side of your neck moved well because that's the side of your neck that is doing work, and the left side's the actual, we would say, stiff side that is causing the right side to compensate and do extra, and that's why the nerves and the discs are injured on the right. So we got to get your head. I want you trying to be off the right side, no sleeping on the right side. You trying to get your head, if anything, on your back. I know you were trying to sleep on your back, or at the very least on your left or not on your right side. Trying to get your head to tilt left will unpinch. So when your head tilts left or rotates left, the holes that the nerves go through on the right get larger.
okay.
So it's a way to try to lessen some symptomatology while the injury in your lower neck heals. Just try to, if you feel that coming on, what, right there, this knot right here causes your head to tilt to the right, and that further, stresses the right side of your neck, especially the right lower. There we go. How's that feel? Just stiff a little bit?
Yeah.
Okay. How pain? I mean,
That's not.
Not
When
too
you
bad?
press on it, it's just the electricity here.
you feel it on the right arm.
Yeah.
Okay. All right. It's just proximity. When I ask the upper neck to move, it really should move independently. But if the lower neck moves in conjunction, then some of that movement just is sitting around the nerve, and then you feel it in the arm. It's just not moving independently, which is why the injury happened. If the upper neck was moving independently, the lower neck wouldn't be stressed out in the first place. Hopefully it just is uncomfortable where I'm pressing. That's kind of our goal. But if it's hurting too much in the arm, let me know.
No pain will ever be like the pain of the disc touching my spine.
Okay.
I'm pretty good with pain for the rest of my life now.
The scale has been modified.
Yeah, it's totally changed.
Jeez. And for viewers that are wondering, that was in the closet, right? You were getting something, or
Been over once outside in the driveway. Putting ice in the cooler, and then been over to get socks.
Socks
for
in the-
church.
right.
And had church right on the floor, right there.
And then,
Yeah.
jeez.
It was two most terrifying moments of my life.
Nerves don't like being touched. That's right. Spinal cord especially. All right. Here it comes.
I'll bring my son in soon. I want you to just keep an eye on him.
Yeah.
He loves wrestling so much, and he's such a good athlete. But I don't want to destroy him. He's got such a beautiful arch in his back right now. It's like
Maintain it, right?
jealous.
Maintain it, yeah.
Like, oh. Don't say it like that when you're
Right.
give him a little bit of video game time. Classic, 92 Mario. And,
That's right.
Oh, on your stomach.
Okay, all right, take-
This has been for about 18 days now. And 12, 13 of them were kind of miserable. And I was on vacation, a wonderful, beautiful vacation in Iowa. And then in Orlando, back-to-back weeks. And it just put a damper on both of them. It makes me cranky and frustrated. Oh my goodness. Oh, go ahead. Don't stop. Don't even.
Don't
Just-
stop.
I'll just let the pain out. Oh, yeah. All right. Oh.
Okay.
I thought I was gonna be so fit in my 40s. I was so excited. I was like, I'm gonna be that 40-year-old. But instead, you're gonna be that 40-year-old.
You're gonna be that for you, right?
I'm gonna be the other one. You are.
Mhm.
You'll have all the health and fitness, and
Yep.
I'm gonna be.
Everybody's got to work for it. Nobody. It's not a shoe in.
Oh, mierda. Just laugh it off. Oh, my son he had to get a
Just local
steroid
pain.
shot.
Just local pain right here. Where the arm?
No, it's the arm
Arm.
that hurts so bad. I'm just getting
All right.
electrocuted.
All right. All right. All right. Take a break.
Oh.
Yeah. Yeah. All right.
Oh, man.
Relax. Yeah. There it is. Good. I know. To some degree, it's just time. It's a few weeks. Couple. Textbook says 4 to 6 weeks. If we ice it, and I know you've been trying to take the stress off it. Usually, it's not as long, but you gotta live on that den roll. It's just the more forward your head goes, the more constant torque is placed on your lower neck, and so just living on that device, you don't. It usually becomes a story of, and it's difficult, the device, but the more I use it, the better I feel when I'm not on it for longer. Your ability to, say, contend with the day, you go longer without having to use it. Now I can go 3 hours without using the neck device. Now I can go 6 hours, and I can make it almost the whole day without. And then by the end of the day, I'm yearning to get on it. And then you're paying your debt, And then when that isn't sufficient, you come get adjusted. But we're trying to get it so that you can, manage it with the curve. So the curve moves the stress. The more curved your neck is, the more stress we start balancing, and it shares the weight of your spine over all the segments, so that not just one segment's just taking the brunt of everything.
I was getting some kind of just salt, injections in those knots, like an all natural salt, but I stopped. I wasn't doing anything worse. I thought in some days it was making it worse. Those things just drove me crazy for like the last 3 years. I'm like, what are they? They're part of your muscle? Can they be cut out?
Right. It doesn't, even nerves, the only way for it to be happy is for all the nerves to not be sending. So the nerves are actually constantly sending signals to your brain of no pain. And so if they remove the nerves, you lose the no pain signal, which then is interpreted as pain. The only satisfactory way it works is if everybody's hooked up and nobody's upset. The tightness is postural and guarding.
Right.
So when there's no longer something to guard, it will go away. Or if the head's over the shoulders and there's a curve in your neck, it will go away.
Okay.
You can't force it away any other way than that.
I got you.
But we're looking for the quick, let's inject it and see what happens.
Right,
It's
right,
like
right.
First of all, salt's a nerve irritant. That's one of the first studies they did with the spines. They took salt and they injected it into the nerve roots, and they kind of mapped out the dermatomes of the spine. And you know, I can't really speak that intelligently about why. I mean, okay, you're trying to. I mean, just injecting something. I imagine you're getting blood flow. You're stimulating blood flow, which brings in oxygen, ATP. You're trying to release some of the tightness in there. If you don't get to the reason for why it's happening, I don't see how we're gonna get anywhere.
My wife said there was a crazy bruising that happened right here. She was
I
like,
see it,
yeah, and then it turned almost like, I don't know if like
This kind of looks
acid ate through it.
This kind of looks like this is like an ice burn.
It could have been ice. That's what it was. Ice
I think
burn.
it's
Most
ice.
likely ice burn. Then I iced it over.
It's okay.
That's what it was. All right.
You frost.
You frostbite yourself
Yeah,
a little bit.
frostbite.
Let's see if we can bring back this online a little bit.
Do you still get the laser kind of routinely?
No,
Okay.
I went in and after like 4 sessions, I realized, okay, I couldn't sit down for more than 5 minutes
Okay.
right away. And then in about 2 months, I could bring my knees to my chest. But there was nothing else really happening. It was just the first 2 little cracks that you do on my while I'm on my back, right?
Right.
And then the laser therapy, and that's what I did.
Right.
And I started to get I clung to that laser, and I think about 6 or 7 months of 2 sessions a week, I finally just stopped, and I thought that's probably enough.
Right.
Let's see what happens here, and then
Yeah.
everything's been okay. I've tested it in jiu-jitsu once a month, and I just made sure to do the cobra pose every morning. It was just knees to the chest cobra pose. I'm doing it at noon now, since you said stay off in the mornings, but knees to the chest before I got out of bed. Cobra pose with not cobra, sphinx pose with a pull, stretching the spine while arching it, and that's got me through to a point where I guess I'm not terrified of my lower back anymore. But there's those days where you're just don't get too comfy.
That's right. The monster's always hiding right behind the door.
Right.
Hey,
I'm thinking about opening up a jiu-jitsu school soon and teaching and.
Excellent.
But part of me is just can you what? Oh yeah. But the time I feel best is when I'm doing jiu-jitsu or afterwards. But one of the traumas I had was the morning after training and training with some big guys, the bend over and twist. So I've had to kind of take that into account. I didn't want to.
Just local, right?
Yeah.
Yeah. Good.
Yeah.
Hang in there.
Yeah. I can't. I don't wanna hold you in our heart. It makes me wanna work. Remember that show?
I want to hold you in my heart, makes me want to fart.
You remember that show?
No.
Camp on Awana from.
Oh, Camp on Awana.
Yeah, I forget what it was called. Salute Your Shorts.
Salute Your Shorts. That's right.
There
Oh
you
my
go.
gosh.
It just came out. That's the song that came out of my brain in that pain. I didn't plan it. That's where it came from. Can I cuss in Spanish?
Oh yeah.
I
You can cuss in English.
try not to
Leave it
cuss
out.
at all, but I find myself saying coño a lot. My mom used to say it when I was a kid. I think it means damn. Coño. Yeah, it's just
It's rough.
still just lightning in here, but
Put it underneath your thigh. See if that. Bring it underneath that thigh.
okay.
See if that changes it.
I'll try it.
Opens it up a little bit.
Ay. Yeah. Trying to use spear fishing to fill in the gap for no longer competing in mixed martial arts or competing in jiu-jitsu. All right. Well,
You gotta find something.
get to go down there.
Right.
Do man stuff.
Mm-hmm.
Get rid of that knot. Just that's the one. That's the one. My son every day goes, "Hey, do you need me to work on it?"
This is just local, right? Just local?
Yeah,
Good. Okay.
buddy. It's local like a mofo. Oh, it's local. It's definitely local. It's. Okay, just go there, Justin. All right. Just go back to where your spinal cord got touched, and then this becomes like pleasurable. Right? All right. My broken disc just touched my spinal cord. Go. Yep. Okay. Yep. I don't feel anything. You know the guy with the Fu Manchu from Big Trouble in Little China?
Mm-hmm.
His face just appeared. I don't know why. It just.
You need to punch it.
On my worst days when I'm cranky,
Mhm.
I tell myself, look, most people would be on drugs.
That's right.
Tiger Woods is driving cars off cliffs,
Mm-hmm.
having back surgeries with the best surgeons.
Mhm.
You know,
Having multiple
multiple back
exactly, over and over
surgeries.
again.
He's got the best doctors, so
Mhm.
I'll skip it.
He's still not happy.
Skip the
right.
drugs and the
Mhm.
surgeries. There's gonna be drool on this wax paper. But I'm guessing that's what it's there for. Ah. Trey, you.
Oh, I did really enjoy The Chosen. If you guys didn't see The
Yes.
Chosen, yeah. At first, I was like, I don't know. It's just a lot of filler.
Right.
But then, as I really watched the filler, I said, okay, this filler doesn't change
Right.
the gospel or anything else. So, yes, I kind of like this filler now. It's just filler. I think for the seasoned believer who ain't going anywhere from the faith, it's a really cool treat with all the filler. And I don't know, I enjoyed it.
I agree.
And then my wife made me watch Downton Abbey, and I got
Woohoo!
addicted to it. It was like the first 3 episodes, like, well, I guess we're not doing anything every night since this is what you're going to watch. I'll
That was me like, what, a couple years ago?
I'll be back there.
Finally caved.
And then I caved. And yeah, it became my show. Man, I wish I would have took care of my spine. I just do. Anyone
How
listening,
many arm
take care of your
bars and
spine now.
How many guillotines you've done with that arm, or you know, exactly all the moves you've done.
There's one of the spots, yeah, all the way down that line.
Channel, yeah, I'm gonna try to clean it up.
Hurts.
Let it go. I got you.
We were at the beach like 3 days a week with my family, which is, we're getting the beach in.
Cool. How many kids do you have again?
I have 2 treasures.
Hmm.
They are so awesome.
Yeah, there's definitely some of the muscle here has been, like I said, I know you
It's
told me
destroyed,
it
yeah.
feels weak, and so
Yeah.
the health of the tissue degrades because the nerve is what supplies the health.
Okay.
So there is acidity, and this should help get some Epsom salt on the arm if you can.
Okay.
Or the faster this mark goes away, you should see improvement. And
Okay.
at least the health of the tissue. But ultimately, yes, it's dependent on that lower neck and getting on your neck dental. And we're gonna just review that again in a minute and just make sure you're doing that properly. There you go. Good. There it is. Good. For the sake of your neck, at least, getting this in will help. So part of it, you can't get your head back if this is so hunched here, right? So the more this humps, backwards here, the more that your head's going to go forward, the more stress goes to your lower neck. This is getting way too tight in here, and this is contributing to why your lower neck is in the situation it's in. And it will at least hasten the recovery of your lower neck by getting this area moving and then getting it positioned back where it belongs. So if it's too low, it can make the area that's injured bend too much.
Maybe that's how this all got started again, because you know what? I was pressure washing my wrestling mats, and that was like 2 days of your head down looking at the mats. And I realized, oh, I better get on my dental roll. I started to do that, but I had it really low, and then here we are, a month later, like. Yeah,
you pissed off the lower neck too much. It's a powerful device. It takes an area and makes it move.
This feels really good.
If it's the area that's frozen, it's good for it. But if it's the area that's already edgy, it'll make it do extra, and that's where you can get in trouble. If you feel anything in the lower neck,
this turned it off right now. Like
it should.
It's like
it should. It takes
just turn right off.
Yeah, it takes the tethering off the cable. So the wire goes through this hole, and if you hold the rope or the nerve taut, it doesn't have any ability to maneuver or avoid the bone that it goes through, and so it makes the nerve loose and able to adjust and move itself around. The curve in your neck untethers the spinal nerve roots. The difficulty also is if your upper neck hasn't been adjusted, even the proper usage of the dental roll can hurt people.
Right.
Because it doesn't. If the upper neck is too tight, then you make the lower neck move too much, and so if it's been more than at least a month or two, especially for you, you really shouldn't even use the dental roll.
Right.
It's to be used with observation, care.
Right.
It is like I said, it's got the power to help you, but it's also got the power to, it's a butcher knife. It can cut onions or it can stab something. It depends on how you use the thing. So it's a tool.
Wait, like a week or two?
See next
3?
week. Next week.
Okay.
I'll try. Let's go next week. Monday I'm closed, but.
Can you kick him or something?
No!
Or the camera?
No, he's injured.
He's
This will hurt his lower back.
Thank you.
Thank you.
Thank you.
Thanks.